Hi, Dr. Jerome Fryer of Dynamic Chiropractic Clinic. I just wanted to hop on and kind of share with you the backstory behind where Dynamic Chiropractic Clinic, the dynamic component, comes from. Back in, I would say, 2007, I began sort of learning a new technique on how to increase nutrient flow into these intervertebral discs. So these discs over the course of a lifetime will lose height. Right? Part of defining them as when the radiologists look at the age of a spine, the disc heights are diminished. So the disc heights naturally come down with the axial component of gravity, right? Compression through the spine. So I thought, okay, well, what's the common theme that we see with people with back pain? And what we see is that radiologists report on MRI that the disc heights have come down, so decreased disc height. So I thought, okay, well, if this is important, how can we increase that disc height to improve the hydraulics or improve the health of these discs or improve the longevity? So there's manipulation, which was traditionally, we were taught manipulation, which is a rotational component where it actually gaps. Oh, here we can get this. There we go. I can feel, right? You can hear it. So there's a bit of a gap. There's a gapping component that occurs in facet joints. Right? That's when you get the patient on their side and you manually work to rotate to create a gapping of the facet joint. That does improve the laxity of the joint, improves the mobility of the joint, but it's the disc that ultimately governs the health of this whole motion segment. So I thought, okay, is there a better way that we can influence this disc here on top of, or in addition to, or in place of the manipulation that we were trained to do? So if you know that when you come into the clinic, often you'll get decompression or deloading or offloading. And I'll put my hand on the spinous process here, and I'll work to decompress a particular segment, creating a low pressure within the joint here. So we've been learning over the years that there are certain types of decompression that works better, right? In the late 70s, they were basically hanging everybody upside down to decompress their spines, people that had back pain. But there were problems with that because the heart doesn't normally get blood that way. So the people were actually having problems with regards to cardiovascular accidents like strokes and thrombi and emboli. These particles would get dislodged within the vessels. So hanging upside down is not the greatest thing for everybody to do. So then they developed these inversion tables. The inversion table similarly hangs people upside down, but some people will respond favorably. So I thought, is there a sort of a way that we could decompress the spinal segments to increase the disc height of the spine? And we were taught this technique called flexion distraction in our chiropractic training, but not everybody had tables. I didn't have a table, but then in 2007, I bought a table that allows me to dynamically move the spine while holding onto that spinous process to open up the joint space to create a low pressure in there. That was developed by a guy by the name of Dr. James Cox. That actually, unfortunately, he just passed away, but he was a huge contributor to this treatment. In 2009, I went to Scotland to learn further about this exercise, the decompression, right, where you push your hands down to offload the spine. This was something that I had came up with when I was in chiropractic class and watching a C students, and they were all sitting, we were learning about the the negative effects of compression and sitting. So I thought, why don't we just offload the spine? So I started putting that into practice around 2000, 2001. There was a positive response. People were getting better. So I thought, wow. So in 2009, I went to Scotland using upright MRI and to measure this further. And there I was able to see how dynamic the spine actually was and is. And it doesn't take much to offload the spine in order to influence it. We see this in people when they go to shift, when they've been sitting too long, they just move a little bit. I think it's happening often when people are doing it inadvertently and they're just doing it naturally. So what I do is I work to try and improve the health of the discs. And what we've seen recently in the literature is that the frequency, or what's the rate of decompressing the spine, that optimizes influx into these discs. And there was a paper published not too long ago where they looked at and they compared different frequencies. And what they found was the frequency at 0.5 hertz, or approximately, which is every 2 seconds. 1, 2, right? 1, 2, was the best at delivering nutrients into the disc. To me, this was fascinating. And the reason why it was fascinating to me is because it matches up with the breath rate. These cells live in a dark environment, pitch black. But what they do know is they know, this is called mechanobiology, so there's forces that are exerted on them naturally. These cells that live inside the disc that promote the synthesis of these things called proteoglycans, they live in an environment, it's like a sea. Think of like a sea and you've got the kelp going back and forth. This is the rhythm that they understand. So tapping into this 0.5 hertz, or close to it, doesn't have to be exactly, but around there, I think we're going to learn in the future that optimizes the nutrient influx into these discs. And that's why often I will use flexion distraction at specific segments. Like say, for example, I want to target this one. I'll put my hand here and the rest of spine moves this way so you can target a particular segment. Sometimes they're too sensitive, and that'll tell me that there's a little bit of laxity or it moves too much and core stability is required. So anyways, that's where the word dynamic comes from in the logo and in the brand, because it's, where there is motion, there is life, and we're learning about what optimal motion means for these discs. So, all right. Hope that helps something that you're doing.